Hi, good afternoon, everyone. This is Anna Ricklin. I manage APA's Planning and Community Health Center. I'm based in the Washington, D.C. region, and we are hosting a really interesting webinar this afternoon through our Plan4Health project. We're calling this A Story of Health, and I'm happy to host Ted Shetler from the Science and Environmental Health Network and Maria Valenti from the Collaborative on Health and the Environment. And Maria is going to speak first. She is the National Coordinator of the Healthy Aging and the Environment Initiative of the Collaborative. And prior to joining CHE in 2010, she served for nearly 2 decades in leadership positions with Greater Boston Physicians for Social Responsibility. She helped develop and manage national and multi-state environmental health education and training programs there, including a publication in Harm's Way training program for health professionals, the Pediatric Environmental Health Toolkit, and Environmental Drivers of Chronic Disease, focusing on healthy aging across the lifespan. I have had the pleasure of meeting and working with Maria in the past, and she is also a co-author of several major peer-reviewed publications, including what we're going to hear about today, A Story of Health, multimedia ebook, Environmental Threats to Healthy Aging, a closer look at Alzheimer's and Parkinson's disease, In Harm's Way, as I mentioned, and Generations at Risk, Reproductive Health and the Environment. So with that, Maria, maybe you can kick it off.
Thanks so much, Anna, and to Elizabeth for inviting us to speak today. We're delighted to be speaking with community public health professionals and planners involved in the Plan4Health project. As someone who has acted in my own community, I understand the vital role you play in creating blueprints for healthy communities. I know that some of you will be attending APHA in the next week, and the theme this year is Health in All Policies. This is also a theme that resonates throughout A Story of Health. So in this slide, you'll see an overview of A Story of Health, which is a multimedia ebook that delves into how our environments interact with our genes to influence health across the lifespan. You can see the family at the center. This is the entry point for all the stories. And we tell a story of health through the lives of fictional characters and their families that you can see in this picture. The first 3 stories are Brett, a young boy with asthma, Amelia, a teenager with developmental disabilities, and toddler Stephen, recently diagnosed with leukemia. And although our characters are fictional, the risk factors they face are very real. And as Dr. Shetler will describe, these cases are rooted in real life. So each case features the latest scientific research about disease origin and helpful facts about disease prevention, including policy recommendations, which we know that you're involved with. We use illustrations, graphics, and videos, pop-ups, links to a wide range of additional resources, and hundreds of scientific papers to enrich each story with information you can use today to promote health and prevent disease. It was designed to be accessible to a wide range of audiences, so if you want more technical information, you can go deeper and review the hundreds of references that are there, which also, almost all of them have links to the papers online. The ebook also offers free continuing education credits to the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry, which is one of our partners in this project, along with CHE, the Collaborative on Health and the Environment, the Western States Pediatric Environmental Health Specialty Unit, the Office of Environmental Health Hazard at Cal EPA, and the Science and Environmental Health Network. It's always a mouthful. You'll see at the bottom of this slide where you can download A Story of Health at the Berkeley pages. You can also find it on our CHE site, and if you just Google A Story of Health, you'll be able to find it. So A Story of Health, in the introduction, we discuss an ecological approach to health, or how individuals and families are progressively nested within communities, societies, cultures, and ecosystems, and each of these levels has significant influences on the others. Each can even influence levels of healthy or harmful biologic markers, such as stress hormones, that can be measured in people's blood. So our environments really can literally get under our skin. An ecological framework recognizes the key contributions of each level to the health status of individuals, families, communities, and ecosystems. And they range from the societal to the subcellular levels, like you can see on the smaller oval there. The interactions and feedback loops within, across, and among these levels are complex and variable, and they exert their influences on health across time. So it's complex, but this complexity also provides a tremendous opportunities for intervention at multiple levels. So what we cover in A Story of Health are the multiple environmental factors that influence health, include the built, chemical, food, natural, and socioeconomic environments, and how they interact with each other and also with our genes to create the conditions out of which health or diseases emerge. And Ted's going to talk a little bit more about that, but you may have a situation where you have a nutritional deficiency that's combined with a socioeconomic deprivation that's combined with environmental exposure, such as to a substance like lead, that all come together to increase the risk for a health outcome for someone. So these environments are further expressed through education, housing, workplaces, access to health care, nutrition and availability of healthy foods, and how to prepare them, which I know is one of the things you're working on, land use, and access to green and open spaces, which is part of active living, and vital to health and well-being, and more. And in the background of all of these, of course, are institutions that shape and control most of them, from an industrialized food system to a poorly regulated chemical infrastructure. So this slide just shows some examples, which Ted's going to show a lot more of some of the graphics and illustration videos, pop-ups you'll find in The Story of Health. We tried to make it as interesting as possible to a wide audience. So before I introduce Ted or turn this over to him, I just wanted to talk about some of the common themes that we have across the stories. And it was really interesting to us as we were creating these stories to see these common themes emerge, that important environmental influences come from the natural, chemical, food, built, and social environments, socioeconomic environments, as I just mentioned, that most diseases, as well as good health, are a result of complex interactions among multiple environmental influences and genetics, that early life experiences, particularly during critical windows of development, can have profound, lifelong, beneficial or detrimental effects, and that preventing disease and promoting health require actions and commitments from the individual, family, community, and society, because they really are all interconnected. So with that, I'm going to turn it over to Ted Shetler, who will go into more details with examples from the stories and how they may be useful to your work.
Thanks, Maria. I just want to quickly introduce Ted to our audience. Ted Shetler is a science director of the Science and Environmental Health Network. He also serves as science director of the Collaborative on Health and the Environment, where Maria works. And he has a medical degree from Case Western Reserve University and a master's in public health from Harvard. Shetler is co-author of Generations at Risk, Reproductive Health and the Environment, In Harm's Way, Toxic Threats to Child Development, Environmental Threats to Healthy Aging, and this topic, A Story of Health. He has also published The Ecology of Breast Cancer, The Promise of Prevention and the Hope for Healing, and a number of articles on related topics in peer-reviewed journals, and also served on advisory committees at the U.S. EPA and the National Academy of Sciences. So thanks, Ted.
Thanks very much, Anna, and thanks to all of you for joining us as well. I'm going to, in the next few minutes, really sort of rapidly go through a series of pages from A Story of Health, mainly to sort of point out to you what some of the features are and some of the topics that we cover, and hope that it will prompt your interest in downloading the report from the web, as Maria mentioned, and taking a closer look at it yourself, because it is really filled with a rich collection of information and references and so on. So let me just begin with, if I can find my control here with the slide. The first story is the story of Brett, a 9-year-old boy who has asthma. He lives with his mother in Southern California, and we've really done this in a way that I think is probably very typical of many children living not only in Southern California, but many parts of the country. You'll see on this slide several icons. I'll just briefly point them out with the black box and the various symbols inside of them, which is the way that you can click on that and get down into more detailed information on topics that are of particular interest to you. So this is a feature that you'll see running throughout this entire ebook. We have then some discussion of the various risk factors for asthma. You'll see them over on the right-hand side of the slide that include various kinds of air pollution, both indoors and outdoor, tobacco smoke, socioeconomic stressors, neighborhood factors, obesity, infectious agents, and genetic background as well. These do combine in various ways to result in both asthma in an individual or asthma patterns that we see in populations. You'll also see an icon here for a video, this one featuring John Balmes, who's on the faculty at UC Berkeley, who describes in this video many of the risk factors for developing asthma. So this is another feature that's scattered throughout this book as we go along. We point out that asthma risk factors can begin early, even in pregnancy, and we talk about how various environmental factors can actually influence lung development in a developing fetus and later after birth in childhood. And another video with John Balmes describing the evidence that relates air pollution and smoking to prenatal and early childhood development and lung function. We talk about potential asthma triggers in children who already have the diagnosis, and you'll see a collection of them on the right-hand side of this slide, including various kinds of air pollution, as well as nutritional factors and allergens in the environment, pollen and pet dander and pesticides and environmental chemicals. Each of these then is referenced, and more detail is available as you go through the book. Air pollution is, of course, well known in its relationship to asthma. What I think is new in the past several years that was not previously demonstrated with any certainty is that exposure to air pollution, particularly it's been studied in Southern California, but it would be true more widely, is actually related to the onset of asthma and not just exacerbation of asthma in children who already have the diagnosis. And another video with John Balmes explaining that relationship. Here you'll see on the right-hand side an example of a fairly new and interesting tool that's available in California, and hopefully it'll become more widely available in other areas as well, called the Cal EnviroScreen, which enables one to look at particular geographic areas and do comparisons of things like, for example, here, diesel-related particulate air pollution on the left and overlain then in the same geographic area with childhood asthma. This Cal EnviroScreen has a number of other parameters that are also recorded in the database, and so you can see how you can begin to overlay poverty and drinking water contaminants and air pollution and asthma and other health outcomes, begin to see what kinds of patterns emerge in your communities where you're doing planning, and help then to see how one might begin to mitigate some of the adverse effects that result from these cumulative exposures to various stressors. We talk about the importance of nutrition as part of a comprehensive approach to both preventing and to treating asthma, which of course then relates to the availability and the affordability of nutritious food in communities. And then finally, we talk about various policy initiatives that we can imagine both at state and federal levels that will help mitigate some of the risk factors for asthma and ideas about how planners in city and highway planning, for example, transportation, bicycle-friendly streets, accessible sidewalks, and so on, how these things can be employed to reduce asthma risk in communities. And I might point out that virtually all of these will have co-benefits in terms of reducing other health outcomes as well. The second story that I'll point out is fortunately a much less common disease than asthma and learning disabilities, which is a third one. But this one is an uncommon disease, but a sad and tragic disease in many cases of childhood leukemia. Stephen is a 3-year-old boy who lives in a Connecticut suburb. His parents own and operate a garden center, as you'll see here. Stephen developed a rather non-specific illness in which he didn't seem to recover very quickly, and he went to see his pediatrician. And long story short, he was diagnosed with acute lymphocytic leukemia, which is the most common form of childhood leukemia among those that we see. We then go into a discussion of the factors associated with childhood leukemia, and you'll see here some icons that enable you to get more deeply into this understanding the concepts of risks, risk assessment, and how studies are actually done. Among the various risk factors for leukemia is emerging evidence about pesticide exposures, and you'll see here, for example, a link to a video that in which Catherine Metier, who is one of the principals at the Center for Integrative Research in Childhood Leukemia and the Environment at UC Berkeley, talks about pesticide exposures and their relationship to leukemia risk. And you'll see on the right-hand side just a snapshot from a paper in which these studies have been systematically reviewed, and you'll see what the evidence is. We also talk about the relationship between air pollution and leukemia risk in children, and give references to that. You'll see them over on the left-hand side as well. And we talk about the evidence that nutritional factors and folate deficiency increase the risk of childhood leukemia, and therefore the importance of good prenatal care, prenatal vitamins, and prenatal nutrition. And you'll see in the center of this slide icons that enable you to get more deeply into a discussion of preconception, healthy child development, prenatal care and healthy child development, the evidence for importance of folate supplementation, and so on. Here we have an opportunity to think more deeply about the question that parents inevitably have, which is, why did my child get leukemia? And why that's also always so difficult a question to answer, or typically is difficult to answer for a particular individual, and how we think about that as both a question that parents have, but also how we think about that in terms of population patterns of leukemia and other similar diseases, and why it's important to think about this at the population level and take this ecological approach in which we're trying to reduce risk factors across populations with the hope and expectation that we will be really influencing the pattern of diseases as they emerge. The third story is a story of Amelia, a 13-year-old girl who turns out to have some learning disabilities, which weren't immediately apparent when she entered school, but which became more apparent as she reached this age. And this is not at all an unusual or atypical story, particularly for girls who tend to manifest their learning disabilities somewhat differently than boys do, and often are not recognized earlier in life. So we then discussed the various environmental factors and other stressors that can influence brain development and function and developmental disabilities more broadly. And you'll see them scattered here around this image of the fetus on the right-hand side of the slide, and you'll see that they really cut across many factors in our communities: nutrition, infectious agents, various perinatal events, of course, and then in addition to genetics, the social environment, environmental contaminants and toxicants. All of these can combine in various ways to influence the likelihood of developmental disabilities, including learning disabilities. So we walk Amelia and her family through this experience. It's, of course, a problem that the parents immediately sort of are quite worried about. Why did this happen, and what are we going to have to do, and what are Amelia's prospects going forward? So we actually have the family undergo an evaluation, and we talk about what that involves and what some of the interventions are that can help mitigate the impacts of learning disabilities, and we discuss them in more or less depth depending on the level of your interest, and you can see those icons again in the center of the slide that enable you to go more deeply into some of the causes and some of the interventions. We show an example from Amelia's community in Louisiana about what toxic emissions are. This comes from a database called Scorecard. You'll see it there in the center of the slide. And it's possible to go to that site and search for your own community and learn what toxic chemicals are being released that are reported to what's called the Toxic Release Inventory, a federal database which collects this information. We talk about the effect of air pollution, and particularly traffic-related air pollution, on brain development and function, and we point out that Amelia and her family had moved from Baton Rouge to a small Louisiana town where the house that they bought was actually on a truck route that came through the community and resulted in a fair amount of traffic-related air pollution. And we talk about the effect of pesticides on brain development and function and what some of the alternatives are to pesticide use. Here on this slide, we refer to integrated pest management as a way of at least reducing the amount of pesticides that are used on lawns and gardens. And we talk about environmental contaminants like mercury that gets into the food web and into fish, resulting in unhealthy levels of fish, levels of mercury, I should say, in some fish that can result in brain damage and impaired brain function, and point out access to databases like fish advisories that are issued by both the federal agencies like Food and Drug Administration and the EPA, but also point out the importance of looking at state fish advisories for more local information. We make the point that interventions to reduce lead exposures in children have been highly successful across the population, although there continue to remain some populations and people, particularly in urban environments, that continue to be exposed to unhealthy levels of lead. But this is an opportunity to point out how policy interventions can actually make a big difference in terms of reducing neurodevelopmental toxicants like lead levels. And finally, we get Amelia's parents, Gloria and Daryl, involved in a community group that is looking more closely at environmental stressors in their community because of concerns that other families have had as well. And in the process of getting involved, they attend some community meetings. They learn something about doing community health studies. You'll see an icon there that in the center of the slide that takes you to some very useful information on the pros and cons of doing community health studies and also a better understanding of chemical regulations at the federal and state levels. We talk about interventions that benefit Amelia, such as getting exercise and getting out in the natural world and surroundings, which has clearly been shown to have benefits in terms of cognitive function and general health, well referenced and well worth thinking about the benefits of green space as city planners and others are making choices and decisions about community design. We also have Gloria and Daryl get involved to the point where they are actually able, through their advocacy, to get this truck route through their community moved to another area. And I would point out that this is actually a real-world story that just came to a happy conclusion in East Oakland, California, where after many years of advocacy, community groups were successful in getting a truck route that came from the busy port of Oakland right through some of the East Oakland communities. They finally were able to get that truck route diverted and improve the air quality in their communities near the port. And so finally, just to reiterate what Maria said, there are some common themes that emerge in all of these stories about the importance of multiple environmental influences on health that come from the individual and the community and societal levels, that there are windows of vulnerability during development where exposures to stressors can have lifelong impacts, and that preventing disease and promoting health requires actions and commitments at all levels, both not only the individual and family levels, but community and societal levels as well. And of course, this relates very much to the work that you do in your planning association. So with that, Anna, I'm going to stop, and we'd be happy to take any questions if there are any. Thanks.
Thank you. Thank you both, Maria and Ted, for your remarks and walking us through this resource. This is a really neat way to illustrate the impact of the environment on individual health, and of course, individuals add up to families, and families add up to communities, and it's really neat to see these connections laid out. And I'm wondering if, just in our last couple of minutes here, you guys could talk about or give your differing perspectives on how to use this tool in the context of advocating for new policy, for example, that you just mentioned, or whether that policy be something citywide, like changing truck routes, or even something like advocating for funding to develop an open space into a park.
Well, I'll just take a quick shot at that. I think that, as Maria mentioned, there's something here for everyone to do at every level. And I think when you're working at the community level, you really have some important opportunities in terms of open space, transportation planning, access to affordable and nutritious food, and reducing air pollution through a variety of policy interventions. And I would also point out that virtually all of these things that can be done in those realms will have real co-benefits across a lot of disease outcomes, whether it's obesity, asthma, learning disabilities, various kinds of cancer, cognitive decline and dementia, cardiovascular disease, diabetes. All of them will be positively or influenced in the right direction with interventions across that spectrum of opportunities. And so I think that the economic benefits are clear, and of course the health benefits are clear as well. Maria, you probably have some additional thoughts.
Yeah, I just wanted to add that I think when people are working on specific issues, we all tend to focus on that issue and not think about the broader interactions. And I think that going back to the APHA theme of health in all policies, that if you're working on increasing the ability for exercise and active living for people, you need to think about more than just putting in sidewalks and creating spaces for people, but also what are they breathing? What might they be exposed to in terms of the chemical environment? Is there food accessible and local, but also, is there an effort to reduce the use of pesticides? So there's all these multiple layers, and I think that's the beauty of a story of health is in a lot of the scenarios, multiple factors are brought in which enable people to see, oh, it's not just this thing and this thing, but we really need to create a real global, healthy environment that involves multiple factors. And we're recognizing that you can't do everything at once, but just to keep that in mind when you're working at the community level.
Great. Well, thank you both for joining us, for presenting this neat tool. We'll have the slides posted, a recording of the webinar, and of course the tool itself is linked on our resources page at plan4health.us. So I look forward to talking to you again soon.
Thanks very much, Anna.
Thank you so much. Good luck.
Bye.
The program.
The leader has